Lancaster here with Westside-Medical. Today we're going to go over how the disc receives nutrition, how the reverse hyper can aid in that. So what we have here, this is actually the motion unit in the spine. It's composed of two vertebrae and a disc. And we'll look here a little closer. This here is the view of the disc from the top. Here's the outer part, called the annulus fibrosus, and this here is the middle part, called the nucleus pulposus. Now don't worry, you don't have to spell it, it's not going to be a quiz later. But anyways, this outer part here, the annulus fibrosus, is a dense, fibrous connective tissue, and this middle part, the nucleus pulposus, is kind of like a bag full of water. And so how the spine works is when you have compression, this nucleus pulposus pushes in to the annulus fibrosus here, and that kind of distributes the weight. And so how the disc here receives its nutrition is you have arteries that run along here, and they penetrate about a third into this disc. And so the nutrition is primarily through diffusion. And diffusion is very important because this nucleus pulposus here has cartilage cells, and the cartilage cells make, it's called proteoglycans. It's a fancy word for a molecule that attracts water. So when this disc here receives nutrition, it produces proteoglycans and the disc stays hydrated and this force is distributed properly. And so with this diffusion, as a clinician, there's a couple things that affect diffusion. As a clinician, we can't affect the polarity of the molecules, and we can't affect the concentration gradient that causes the influx of water. What we can control is the compression and relaxation of tissues that aid in this diffusion. And so when we have diffusion, it carries oxygen nutrients to these cartilage cells that enables them to make the proteoglycans to keep the disc hydrated. Also, another interesting fact is the inner cartilage cells here, they're very pH sensitive. And so if this disc is not receiving the proper oxygen that it needs, it goes through anaerobic respiration and it makes lactic acid, and that lowers the pH. There gets to a point where the pH gets to a certain level, it becomes so acidic that these cells here only work about 15% of their max. And so this pulposus is not going to be very hydrated. So in the clinical setting, what I like to do, so we'll go and pan back up here. How I affect the compression and relaxation of the tissues, I like to use the reverse hyper here. And so to demonstrate, we have these two steps here. So you step on it, get in position, you're going to hinge at the hips, grab onto whatever handle is comfortable. We're going to go through this range of motion right here. It's compressing the tissues right here to the muscle contractions, and that relaxes that traction. So this motion here is going to pump that fluid into the disc. That's going to enable it to get the proper nutrition as well as get the oxygen to make sure those cells are producing the proteoglycans to keep the disc hydrated. So in practice, we start off with 3 sets of 10, eventually work up to about 4 to 5 sets of 10. For more information on this product, visit westside-medical.com.